I'm thrilled to be here. I know you are all in Kansas and the neck of the woods that Carol is from. I actually live in Raleigh, North Carolina, from originally New Hampshire, but they still have winter. So that's why I moved down to North Carolina. It's going to be 85 degrees, which means, of course, I'm freezing because North Carolinians can't figure out how to open windows and enjoy fresh air. So it's 68 degrees in here and my fingertips are freezing. So that you can't live with it and you can't live without it. Carol and I are super excited to be presenting today. And I know this is Carol's home turf, so I got to bring my A game because I totally want to make sure that I give her lots of props and respect. And we are very excited not only to be presenting to you, but to be doing it on the day after our huge launch, which we're going to talk about towards the end. But this has been an amazing week. I have to say I have a very strong affinity for family physicians. I have family physicians in my family. My mom is a retired nurse practitioner. My sister-in-law is a retired hospice nurse. So while I don't happen to have a clinical degree, I am surrounded by talented healthcare professionals, and that's what makes this all that much more important. And certainly as one of the things we face is a very uncertain healthcare world, both from a standpoint of how's it going to be delivered, but indeed some of the health challenges we have, for instance, the opioid epidemic and challenges with people understanding vaccinations. It's just so essential that healthcare folks be socially savvy because patients are. And therefore, it's really important that you all up your game because you need to have a very loud and active voice in what is happening with our personal wellness and health. So there's my my sales pitch for social media. Can you tell I'm an evangelist? I'm a very, very big believer in social media, and I think it has incredible power both to serve healthcare in the community that we're in, as well as serving our community at large with medical and health information that's accurate and on point. So again, very excited to hopefully get you all excited, and I'll be looking for some tweets very shortly after this presentation because you're going to be hopefully all revved up and creating your own handles or reactivating them and getting them going. So there you go.
Janet, I'm really excited. I can see Jen McKinney, the official social media ambassador for KFP annual meeting. She's on deck. So we're looking good. I see Michelle Corkins, who is the deputy director. And Michelle, I bet you probably have the whole KFP team listening in. So again, I don't see Carolyn, so I think we'll go ahead and start. Take it away, Janet, and we'll introduce ourselves. I do just want to give a big shout out to, again, my colleagues with KFP. Carolyn and I actually met on a plane on our way to a conference, different conferences, in going from Wichita to San Diego, and that was several years ago. And we hit it off right away, obviously, and have enjoyed being involved with KFP and the local initiatives with tobacco-free Wichita specifically. I love social media. That's how we got hooked up to help with tobacco-free Wichita, bringing Janet on the scene. So Janet, take it away and let's get this party started.
All righty. So just to keep me on track, Carol, we want to wrap up at what time?
It would be good if we were done by 1:45 for questions.
Okay, because Carol knows that once we get started, we could talk about this for hours because we're big believers. So let's start with welcome to the Healthcare Marketing Network co-founders. Carol and myself, we're here to talk about conference success with Twitter, how to use Twitter specifically at a conference or at a special event. And really, even if you're a newbie, we are going to give you some great suggestions and some good tips to get you started to make sure that it's going to be valuable for you. And one of the things that we wanted to share with you is that we work with a lot of different healthcare professions and organizations who are very committed to spreading the good word through the use of Twitter. And I hope you'll be amazed by the time we end with how many different ways that providers and patients are finding Twitter to connect and engage. So a little bit about ourselves. We gave a tiny intro there, but Carol and I came together through, what a surprise, Twitter. We are both in the Mayo Clinic Center for Social Media Network, and we have found an opportunity to collaborate in there. And when we really engaged in Twitter through some tweet chats, we ended up having a phone conversation that went on at great length and realized that we have an awful lot in common, but also extremely complementary skills. So that's why we have, through the course of the past year, taught together, done webinars together, and founded the Healthcare Marketing Network. In particular, here's my sales pitch. Please give a listen to my podcast. It's called Get Social Health, and it's about social media and healthcare. And you will find a number of family physicians who are tweeting that I have done interviews with, as well as other kinds of specialties and individuals in the marketplace, from medical futurists and startups to physicians and nurses who tweet. So I welcome you to give a listen to the podcast. And Carol, I guess they know a lot about you. What don't they know about you?
Oh gosh. Well, actually, a lot of folks in Kansas know me as an oncology nurse and an oncology nurse activist, and might not always know that I'm also a writer and a blogger and a text broker, which means connecting people who need to tell their story to people who can help them tell it, or writers. So definitely that's something they might not always know. Excited to be here. I think we have a lot of fun things to share with you about how you can amplify, participate at the upcoming conference and amplify your message to the broader healthcare social media network. And we want to help you do that as well.
Excellent. Well, let's get started then. So here are the things that we want to communicate to you. And the first one is, if you think the social media boat has sailed and you're not on it, don't worry, because it's never too late to start in social media. As a lot of these organic platforms are, people come and go all the time. It's like I finally decide that, clogs are cool 10 years after clogs went out of style. But you know what? I can still wear clogs. I'm not sure if that's the right metaphor. However, know that even if you haven't been active before, you're not trying to be a Kardashian and connect to hundreds of thousands of people. You just need to connect to those hundreds of people who really matter with the goals and strategy that you have. So that's what we're going to really talk about today. So we've got a fairly simple agenda because we don't have that much time. We're going to be talking about setting up a Twitter profile. We're going to be talking about what exactly you should be tweeting. And then we're going to specifically address conferences. So what should you be doing before you go to a conference to really set you up for success with Twitter? And then we're also going to talk about conference best practices. And we got some really good tips for you there. Obviously, we're going to tell you to follow us on Twitter. So at Get Social Health or at The Social Nurse, we want to see you guys in Twitter, and we'll be looking for tweets shortly. So let's start with the basics. What you need to do to set up a Twitter profile to be effective in social media. So setting up your Twitter account, it really doesn't take a long time. It's very simple and straightforward. However, we have some very specific advice for you when you think about this. Number one, keep it short as you can. Now, as lots of people have gotten Twitter handles, it's going to be harder and harder to find that unique short URL because so many other people have been there first. However, try to find something that is unique to you, that's memorable, that's easy to remember, that's professional, so something that would make sense to people, and do not, no matter what, include your company name. So for instance, now here, I'm about to point myself wrong here, but you can see that I'm tweeting as Get Social Health, and that's because it's only me. But if my company were to grow and I were to have multiple people, then it wouldn't be clear who exactly was tweeting on behalf of Get Social Health. And we'll get into a few more details of identifying the profile in a little bit. But if it's important that your followers know that you're an MD, include that. Family practice, sure. But Lakewood family practice, probably not a good thing, because if you ever leave that practice or you ever want to tweet something fun, you're at a gala, you're at a conference and you all are meeting up, do you actually want the professional handle to be reflected some of this fun activity you're doing? And we're going to talk about the fact that you can be a real person in Twitter. I would recommend, of course, being very transparent, making sure that if you are using a handle like Get Social Health, or in Bernadette's case, Next Stop, her name has meaning to her. It won't mean anything to the average person, but she also has her real name in the profile. Nothing more frustrating for a person who wants to connect in Twitter to not know, who am I talking to? Am I talking to a junior social media person? Am I talking to somebody who's outsourced? They're not even with the business or the practice, or am I talking to a real person? So if it is you, and if those are your words and your voice, be proud of that and go right out there and tell people that. So be transparent and let people know who you are. Also, that makes it a lot easier for them to find you on other platforms. So at this point, I've been tweeting so long and have a podcast, Get Social Health, will identify with me very clearly. But the fact that my name is associated with it makes it very easy to find in Google search. And ultimately, that's one of your goals, isn't it? Is to build your practice and your reputation. So if your real name isn't aligned with it, you're losing a huge opportunity. And you really want people to know what you think. Twitter's a very personal, professional platform. So what you say, as we've seen examples of, you're going to be held accountable for. So it's better that you tweet as yourself and be able to manage responses as yourself, rather than, as rogue tweets coming from an unknown business. Carol, what are your thoughts on Twitter handles?
Oh, I just go exactly with everything you said. A lot of times folks, especially that I'm talking to, are audiences of bloggers from multiple clinical disciplines. They might be nurses, pharmacists, etc. So sometimes they say, hey, should I tweet as myself or should I have like a, quirky kind of name? And again, my recommendation is always, we're trying to establish your thought leadership. So be yourself, and it should be, I love it if you can choose a version of your name.
Absolutely, that is definitely our recommendation if possible. Now that said, Carol and I both have personal Twitter handles. So in my case, I started with @jkennedy93, and then when I wanted, and I know it's a dumb reason, I was the 93rd person to get a Comcast internet address, and it never occurred to me, whatever, 15 or 20 years ago, that I'd be living with this moniker for the rest of my life. So I'm just telling people I graduated in 1993 and let them figure that out, right? So that's their job. Okay, so one of the things to be thinking about is also your profile image. That is something that often can really lead people down the wrong path. So as a healthcare professional, I think you need to think about a couple different things. Number one, make sure that your picture is easy to spot in a Twitter stream. A lot of times people will have, say, an image where they were at a conference and there might be 3 people in the picture. So you're not actually sure which is the one who's tweeting. Or worse, not worse, differently, for some reason, wedding photos seem to be really popular. Not necessarily bride and groom, but hey, you're wearing a tux or you're at a nice party and you look, dressed to the nines, and that's all wonderful, but a lot of times you'll see there's an arm around the picture and it looks like you cut somebody off. So take a moment, and when you look at mine, jkennedy93, that's a selfie. It doesn't have to be a highly professional picture. As a matter of fact, here's an opportunity for you to be a little bit more casual. But think about the background. When the Twitter stream is flying by, your image is about yay big. So if you can have it be simple, bold, colorful, or something that makes your image stand out, that means your tweets are going to be easier to spot. A lot of times healthcare practices will like choose their practice logo, which is horrible because it's all these words, blah, 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 family practice. All it is a big old mess in Twitter. But you can see with MediVisor, their icon, the image that's tied into their logo is very straightforward, very bright, very colorful, and it pops right out. Also, please smile. I know this sounds crazy, but sometimes people have their like dead serious professional look and it just doesn't come across as very friendly. And make it just easy for people to see who you are. What are your favorite tips about profile images?
I just really like them to be definitely warm, inviting. I love the picture that you included here of Lee, friendly and engaging, because that's really what social is about, that, engagement, social, let's talk, let's visit.
Yeah, I use Lee in an example in another deck. Lee AC is the executive director of the Mayo Clinic social media network, and his other picture had the vague feeling of a Sears portrait. So it was very stiff, dark gray suit, really boring background, which I apologize for this. I'm in a free conference room and I hate the lighting and how it looks here, so I apologize for that. But what his former picture was friendly enough, but it still felt very manufactured. This background is lighter, more friendly, more engaging as he is, and I think it reflects his personality a little bit better. The other important part of your profile is the opportunity to express a little bit about what you're all about. So you can see, again, we've pulled all the same profiles so that you can compare them, but you can see what they're tweeting about are things that they care about. They're talking about whether hashtags or just content, things that are important to them. It is an opportunity for you to be a little more personal. So if for some reason you think that, for instance, I'm Scottish and I love Highland Games, well, there's no reason why you can't mention that, especially if you're going to tweet about that. But it's also an opportunity to let folks know of the different things you're interested in. So for instance, when I'm looking to follow people and I'm looking for, say, family physicians, very helpful to have those related hashtags in your profile area. You can have a link, so make sure it links to where you want them to go. And again, I'm talking to you as an independent healthcare professional, not necessarily the representative of your practice. So do you want that link to go to your practice website, which is fine, or are you actively blogging? Do you have a blog somewhere? Maybe you want to drive them more to content or to the About Me page on your website. So think about, where do you want people to go? If they're like, oh, I'm really interested in what they're saying, I want to know more about them, where do you want to direct them? Carol, what would you say would be important in adding to your profile explanation there?
Well, I really like to focus on the things. When I first started in Twitter, I wanted to develop it as a professional network. And so the things I was interested in, of course, were innovation in healthcare, rural health, and specifically oncology nursing. But I also included a fun thing about gardening, and that actually led me to connect with Deanna Atai, who is actually the founder. She's a breast specialist, breast physician, but she's also the founder of Breast Cancer Social Media. And we traded gardening tips and recipes back and forth. So I think it's good to include your interests. I love that you include something, your personal website or blog, but still go ahead and have fun, because it will open the doors to people you never dreamt you would connect to.
And one thing that does happen in Twitter is you get into off-topic conversations pretty easily if you want to. Therefore, if you have actually something to lead them down the path, then put it there. I love to scuba dive, so that's a real door opener there. The other thing is, there are folks that will put my tweets, are not representative of my company, or retweets does not equal endorsement. While that's all lovely, a lovely thought, it really is wasting good space to talk about who and what you are. Because in actual fact, it doesn't matter whether you say these are my own opinions or not. If somebody finds out that you are a physician at X practice and you said something extreme in Twitter, they're still going to hold your practice accountable. So therefore, you're putting a disclaimer up saying it's your own opinion really doesn't matter when we're talking about reputation online. So don't waste the space. Be professional and don't be too far on either extreme where you would upset people, but use those characters to more reflect the kind of content that you want to share with folks. Now, this is a place where a lot of people will make a mistake, and they'll grab a logo from their practice, or they'll grab just any image and not really pay attention to how it's sized, or they'll not use any image at all. So it doesn't have to be, promotional, which of course mine is, if you go look at mine. So it doesn't have to be that. It can be, for instance, you're all from Kansas. It could be an awesome image that everyone would recognize from your town, your city, or your state. Do you have a national monument there that people love? Is there a geographic area that people love? But it's just a way for you to really kind of soup up your header and let people know a little bit more about yourself. Now, this particular fellow, Dr. Mate, he's only tweeted 103 times, and he's got 43 followers at the time I took this picture. He's only following 43 people, but he's got 10,000 people following him, and I should know who he is. He's obviously a really awesome guy, but what a shame that he wastes this opportunity of being in front of 10,000 people and not using his header to convey a message, even if it's a quotation of optimism or, in his case, a promotion for his latest book. So, even a graphic image is, I think, valuable. And then, looking at that, these are two folks that Carol and I know very well from social media and healthcare. You may know Kevin Poe. He has spoken at a number of national conferences about reputation online. And then Bernadette Keefe, who's a retired physician. She has been so active in social media that people actually think she's at all these conferences when she's actually tweeting from her own home, literally with a tablet and a phone. She doesn't even have the big setup like I would use. So very, very impressive. However, you can tell right away what they're about. Obviously, Kevin is very much about speaking engagements. It's something very important, and so that's why he chose that as a header image, whereas Bernadette very much wanted to focus on, the immediacy of tweeting. So think about your header image and what does it say about you? Even if it says you're a gardener, put flowers up there. I think that's a cool idea, and it's a fun way to bring a lot of color and life to your Twitter profile. Alrighty, so now it's about figuring out who you should be following, which obviously I just realized I missed an O there.
Oh, but maybe it's like flowing. The following is flowing.
Well,
flowing.
In Twitter, it's all about abbreviations that people can understand. So if you knew that word said following, then we're good. All right, so very difficult when you first get started because there are so many people out there. Literally 25% of online adults have a Twitter handle, which means there are millions of people out there. Trying to figure out who to follow can be a real challenge. And the way to go about that is actually find the people you respect who are in your space. So for instance, if you look at who are the leaders in family practice nationally, for instance, our friend Dr. Mike Sevilla, he's extremely active in social media, always makes the top 10 physicians to follow, and he's a big family physician, family medicine advocate. Go see who he's following. So use him as your guide, look at the kind of things that he's tweeting, and even go to curated lists on his Twitter profile and follow the people that he's following. One of the things to look for is who's your conference host. So when you are going to a specific conference, make sure you're following them because number one, you're going to get updates for everything that's happening at the conference. And hopefully they've been curating their Twitter following, and that's a good way to get a sense of who's going to be important to follow at that specific event. Sometimes you'll even find specific curated lists where people who are in attendance at an event might be on a list. Therefore, you can directly follow all the people who theoretically are all around you, and that makes them easier to find at the conference. But I think the best way to go about it is pick the 3 or 4 people in your space that you really respect and go figure out who are they following and who's following them. How about that, Carol? Well, is that what you would recommend?
Oh, yeah, definitely. In fact, when I first got started with Twitter, I was really trying to figure it out because my view of Twitter was, you know, celebrities gone wrong tweeting that they were dancing on the table in a bar. And so I spent a lot of time watching, and I did exactly like you said. I picked thought leaders in my area of expertise, oncology, nursing. Also, because I was big in innovation and telehealth, you know, I look to folks who are innovators in that realm, and that is exactly how I got started following people and connecting. But I bet you I watched and retweeted, didn't really do anything original, probably for 3 or 4 months before I actually tweeted my own first original content.
That's excellent advice, to take the time to read who's out there. However, since we have a conference coming up, we're going to say jump right into the deep end of the pond. Okay, so one way to figure out who actually is influential, and we're going to talk about this in just a second, is follow the hashtags. And coming up, for instance, here's an experience with, I was going to a conference as a social media ambassador for the National Council on Behavioral Health last year. And there's actually a report that will show you who is both active and also who's being mentioned the most. Well, right here, there's some repetition in the list, but there's easily 20 people to get started with for your list. Now, where are you? Oh, we're going to get to that in just a second. So Twitter content and some suggestions on how to manage this fire hose of content. Well, you know, with hashtags, with conferences, it's just a big, giant conversation. It's a tweet chat is a conversation in Twitter where by the use of a hashtag, people around the world could come together and have a conversation just by putting a hashtag HITworks in a tweet and following that stream. Now, people who don't even follow each other, they don't know each other, don't know anything about each other, can now all come into the same conversation. That's what's so powerful about using a hashtag during a conference, is you may never run across any of these other people who are at the conference. They may not be on your Twitter lists, or you might be just getting started. However, if everyone there is following the same hashtag and commenting on the same hashtag, suddenly you're all in the same online chat. And that's an incredibly powerful thing. So let's talk about when you go to the conference and you really want to be engaged in social media. Now, I have to tell you, this is me. This is not you. I know most of you, though, will travel, probably with a laptop or even a tablet. Just make sure you've got all your content set up, you've got your platform set up, and that you're ready to tweet at a moment's notice, no matter where you are. Now, I actually do the majority of my conference tweeting on my phone. What I will have, however, is a couple of battery backups, because if you're taking any video particularly, you're going to burn the battery up really, really quickly. But I have a special bag that I travel with, and I am ready to tweet and be social wherever I go. The other thing to look for if you are in a conference setting is, are there multi-plugs on the tables? Go find those tables first, and they're usually up front. So there's a little bonus to being up front. Or in some cases, if you're not in a room that has the removable walls, you probably have wall sockets. So be prepared to grab a chair and slide over to the wall so you can plug in. I always bring a multi-plug, because sometimes there might be an outlet, but there's only one, and everybody's staring at it trying to decide how much of a smackdown they're going to have to fight over that electrical outlet. Well, as soon as I bring out my multi-plug, I'm like the most popular person in the room, because I'm sharing the electrical. So I highly recommend bringing a nice small multi-plug in. I just bought one recently that was like 3 outlets and then 3 USB connectors. Awesome. So I don't have to have extra widgets to plug my phone in and charge at the same time. So make sure that you're prepared, whether it's having your own multi-plug or it's by having a little battery charger that you can get by a full day without having to, close down shop. Carol, you got any tips for, when people are trying to run on the run and do social media?
Oh, well, definitely keep charged, but I actually have a tip from Carolyn. She just shared on the chat that that they are going to have power strips at every table in the conference rooms at the annual meeting. I mean, how prepared is that? That's awesome. Way to go.
Score. All
Yeah.
right. Well, you get bonus points and brownie points for that. We have to send you brownies because that's pretty awesome. Okay. So if you envision being the social media superstar, we got a couple tips to help you get going. And one is actually to prepare some graphics ahead of time. If you create a template where you have the logo of the conference built into it and some white space, so that while you're, now this is a little more easier, it is a little easier on laptop than it is on phone, but where you can drop in some pithy, amazing quotes that you've heard, let me tell you, your retweets are going to go through the roof. So it's one thing to just type that, and if you're a known person, people certainly will retweet you. But if you create a really pretty graphic and drop in your keynote speaker's major points or quotes, that is going to be shared far and wide. And if you're doing a service to the conference by having their logo in it, by having the right hashtags in it, so it's going to be shared by the community, it's really an awesome way to get ahead of the game here. And then in our case, where Carol and I were doing some work, I also had a little creative graphic that I was able to drop in periodically, once in a blue moon, in between my many other tweets, that was indeed promoting a service that we had. And there's no reason why that can't be done. Now, obviously, at your medical conference, you're not going to be necessarily trying to find patients for your practice, but if you're on a committee, if you're serving for any type of educational group within the community, if you're advocating for any kind of service within the KAFP, here's a great opportunity to say, hey, are you loving this conference? Why not be a part of KAFP all year round? And invite them to meet you, talk to you about the committee that you serve on. So it's a great way to kind of promote while the iron, strike while the iron is hot, and get people really excited about other opportunities. The other thing you can do is create some content in advance and have it ready to go, so that it isn't, you don't have to necessarily do it on the fly. You can actually have these not only pre-done, you can even have them pre-scheduled by using a tool we'll talk about in a second. But Carol, you pulled some of these graphics. What would you say about pushing content out ahead of time?
Well, I really love it, and especially I loved what the KFP folks, the team did here, and shout out to them. They've got a great team. So I just loved the visual that they created, and made this like, a sense of immediacy. It's 4 short weeks until we chart the course for the annual meeting. And then they are including not only a link to register, but also a couple hashtags. Number one, KAFPAM is the annual meeting official hashtag, and they're including Kansas Health. And this is actually a hashtag that they have convened a conversation around. So anything related to Kansas Health, KAFP is just really working to use social media to amplify messages around public health, family medicine, anything related to health in the state of Kansas.
Ooh, that's exciting. All right, we're looking for that Twitter handle. Now, how do you handle all of these different pieces of content and all these following streams? One of the things that we recommend is that you use a platform called Hootsuite, or there's another one called TweetDeck. I like Hootsuite, but there are people who have favorites either way, doesn't matter which. The cool thing about this, as you look at this screen, you can see that in this particular instance, I have actually set up multiple streams to follow. So in this case, I was following the hashtag NatCon16. I also was following BH 365, which is the behavioral health year-round hashtag. So much like Carol was just saying, those two hashtags. I was also following the individuals specifically who were the other social media ambassadors. And then I made a list of the speakers so that if the speakers tweeted something out or someone tweeted something out about the speaker, I was ready with a quick retweet. And let me tell you, you don't have to be producing original content to kind of win the Twitter war. You can actually be a heavy retweeter as long as it isn't, you know, so many retweets, people would go to your profile and go, what is wrong with that person? But it is a great opportunity to go find content. And you can organize it in a place like Hootsuite. So it's all right at your fingertips. And whatever you create on the platform on your laptop will carry over to the Hootsuite app here. So if you create all of these headers, they'll appear over here, and then you can actually use it on your phone. So you set it up before you get there in Hootsuite and then interact with it on your phone. One of the things not to forget, of course, is who's talking about you or trying to talk to you. So I would set up a dashboard that includes mentions for you and about you. It's really surprising how easy it is to miss when somebody's talking about you. And if you've set it up to send you an email, that's great. But when you're in the middle of a conversation, you may find that somebody's trying to get your attention and you're not prepared for that. So, Carol, why don't you tell folks all about hashtags and where to find them?
Well, I just love hashtags because, again, now I think in some realms, people sometimes feel they're overutilized, but originally they were developed within Twitter as a way to organize conversations. So just like Janet said, when we're at a conference, when we're looking at a disease-specific information, everything around a topic, it's a way to organize. So what really makes it powerful is when we have an event or a conference, we actually have a tool, thanks to our friends at the Healthcare Hashtag Project, and this is the website, simpler.com. The team at KAFP actually registered this hashtag with Simpler a year ago. So now everyone around the globe has a place to go to look for conference hashtags, disease-specific hashtags, etc. And this is just a great place to start. So again, this tells us about the specific conference and a little bit in terms of the description, but it is a way that we can track influencers, what's going on, as well as meet other people around the globe who might be following the conversation.
Hey, and there's even more hashtags to come.
So I also grabbed, again, I just wanted to give a shout out because we do want at the conference, actually now, build your profile, start talking about attending the conference, make sure you're using KAFPAM. Also, in the meantime, there's some other topics that you can think about. And again, going back to what Janet said, follow influencers in your space, and definitely Kansas AFP, the Twitter handle. I mean, they are rock stars and leaders in family medicine, social media. So take a look at some of the hashtags that they're using to leverage awareness for example, Hand Hygiene Day, but they popped in there Kansas Health, so we can promote that conversation. And I just wanted to pull out again, I think it's really cool that they're convening and leveraging this awareness, and I pulled that tweet out from Tobacco Free Wichita and Kansas AFP, who are leading that conversation.
All right, so more about influencers. One of the things you'll find when you follow these hashtags and you check these reports is you can find out who's active and who's getting retweeted. So I would go in and immediately start to follow these people who are very popular, and it's an easy way to figure out who you should be following. Now, the other thing is when you're tweeting from a conference, if you got the rubber chicken lunch I wouldn't necessarily spend time talking about that. I mean, seriously, this is an opportunity for you to be huge cheerleaders for your community, for the content that you're sharing. So unless for some reason you got run over by that taxi, let's not worry about the weird Uber driver, and take it as an opportunity to pull conversations together, to keep it upbeat, and to get everybody engaged and saying positive things. And it's a great opportunity for you to give shout outs, cheers, and accolades to your peers and colleagues. So really use this opportunity to say, you know, heard the great speaker X, they were wonderful, or quote them and say, this is what we believe in our practice. But really find a way to use the content you hear to keep it upbeat. And that's how people will want to follow you, because, you know, the one-off snarky comment can be funny and can get a lot of tweets and retweets, but it's also you setting your professional persona online. And then outside of conferences, these hashtags for many organizations are used year-round, and there are regular tweet chats. The Healthcare Leader tweet chat, which I highly recommend, especially if you're new to Twitter, every Tuesday night at 8:30 Eastern, 7:30 Central. Well, you'll find it. This is probably the most professional healthcare tweet chat, because they actually write an extensive blog post to support it prior to the event. They post the questions they're going to talk about so you can come with thoughtful answers. And it has a passionate following of very active folks. So anybody you find in the Healthcare Leader tweet chat, I would recommend following. But there are other hashtags. For instance, the American Academy of Pediatrics has a hashtag every child needs, that you then follow up with good health, supportive families, good education. But they have used that to trigger lots of different conversations about what kids need. It's very, very interesting way to use hashtags to drive tweet chats. So be looking for those. I'm sure after the conference, we're going to have a regular tweet chat in Kansas going on. Okay, and then just a couple tips, because we're running short on time, about what to do to get ready is primarily know what you want to accomplish with this. So figure out what your plan is. Is it just to grow a network? Is it just to kind of understand the technical aspects of trying to tweet on the fly? Or do you actually want to focus on specific topics? So say there's a lot of discussions going on about opioid issues. If that's the thing you want to follow, who's tweeting about that? Where are the sessions that are going to be talking about that? And get a game plan together ahead of time. Because if you wait till you get there and suddenly here's the big old program of everything going on, it's going to be very difficult to figure that out and how to apply that to social media. Whereas if you do the prep now, look at the schedules, look at the things you definitely want to go to and be at, and be prepared, it's going to be a lot easier to create content and share content. Carol, what would you say would be a good Twitter strategy for a brand new person to Twitter?
Oh, my favorite strategy, you know, just even personally, but especially for brand new folks who are live tweeting from conferences, is I love to share like those clinical pearls. And we know what those are. When you're in a keynote or you're hearing a presentation, or you even see the coolest quality improvement project in a poster presentation, snap that a picture, even of the folks who are giving that poster presentation, and sharing it. Or again, that clinical pearl, maybe the speaker is pointing to, you know, whatever results of their QI study or their research or a new evidence-based practice. I love to share just that clinical pearl, and if I can grab a link, I try to do that. In the beginning, it's kind of hard, but I always make sure I have the hashtag, and sometimes go back if I need to tweet out that link. But I love sharing the clinical pearls, because the audience of a conference is not just at the conference in the room with you. The audience of your conference are the rest of us following out who may or may not be there. So you never know what your tweet is going to mean to someone in terms of gaining a new resource or a new intervention that's going to dramatically change their clinical practice. I think it's pretty powerful.
Absolutely. You're really doing a great service to the non-attendees by curating the content for them and, well, showing them what they missed.
Hmm.
The other thing you can do, and this is how Hootsuite works, is if you've got some content you want to share during the course of the conference, but you don't want to have to remember to do it, you can actually schedule things in advance so that you know you've got some content coming out. Maybe they're shout outs, maybe they're references to somebody you know who's speaking and you want to make sure people go. Just schedule that so you don't have to worry about doing it. Hopefully there's going to be some curated lists that you can follow of different folks at the conference that someone has curated themselves, or potentially a list that you have curated and you could share out yourself saying, hey, I've created a list of speakers, you can follow it here. That might be a neat way to pick up some followers.
So definitely here, the Academy has created, look, 7 lists. So you can start out right away following some of these cool people relative to the conference or otherwise. So that was a great strategy that they put in place.
So some best practices, and we're going to fly through this pretty quickly. So why tweet? Well, I can actually think of a million reasons to tweet, but we'll just keep it nice and simple. One is that it's going to keep you in sync with what's happening at other parts of the conference. So even if you're not actively tweeting, you can read the tweets and see what's happening. You can engage with the speakers. What an opportunity to meet some folks you might never have had an opportunity to meet if they're active on social, and many of them are if they're well-traveled speakers. It's a great opportunity to reach out and connect with them and potentially even grab them for coffee. And this is, I think, one of the best parts is I have met total strangers by doing some tweeting back and forth and saying, oh, you're here, I'm here, let's meet for coffee. And I kind of throw a challenge out to one of you to tweet out that you're having a coffee tweet up at breakfast one day and meet us at table number whatever, and try to get all the other social media folks together and share some Twitter tips. And okay, so graphics will pop out. So one thing we highly recommend, if you can either prepare them ahead of time, even you're doing a drawing of something or you're writing a note down and then you take a picture and share it, it is a great way to make what you're sharing pop out. If you can grab a good picture of one of the speakers engaging before, during, or after their presentation, folks love to have a good speaker picture. And so often it's the guy in the back row. So there's a little tiny person this big that they're trying to tweet with. But if you can grab a good picture, use graphics to tell a story. There is a cool platform called Storify where you can actually go in and curate all the tweets. And the cool thing about a Storify is that it archives the whole event or conversation. Carol, you've used Storify before, haven't you?
Yes, and actually, I played around with it just personally when I was attending national conferences for the Oncology Nursing Society. But I also actually was a virtual social media ambassador for a conference I didn't even attend, but I helped the folks who were attending and leveraged their tweets, and then I put the whole story together and it happened to be the National Nurses in Business Association. So this is something you could do as well for any event. It doesn't have to be a conference. It can be even a local outreach event, possibly that you're live tweeting, or a local conference or a symposium. It's a great way to leverage awareness, and it gives a nice, again, it's a storyline. So it's all in one place.
Yeah, it's surprising that even as if you're actively tweeting and you're watching everything, how much you can actually miss. Just to show you what it's like when you are posting your own content in Hootsuite, you can actually create it and upload it in an Excel spreadsheet. The key here is, of course, I've made an effort to tweet out multiple hashtags. So it might be the same comments, but I'm using different hashtags because I want to reach different audiences.
So I love, Janet, that you included tips for all levels of tweeters, beginners as well as experienced, because we want to encourage you to raise the bar, whatever level you're at, bump it up to the next one.
Absolutely. And the other thing is, don't forget to have fun and actually talk to people. So it's great to be virtual, but this is a once a year opportunity to really get face to face with a lot of folks you only get to see once a year. So don't forget to put the phone down and actually talk to the folks at your table. And I sometimes have to take my own advice. And this is something I feel very strongly about personally. The guys down the vendor hall, they're working really hard to be there. And if you didn't have sponsors and vendors, you wouldn't really have conferences, because they really are carrying a huge load when it comes to the finances of supporting a big conference. So please make an effort to just tweet out that you're there. Hey, great meeting the folks at, enjoyed visiting your booth. Thanks for the tchotchke. Think of all the cool, fun stuff. Now, I can't spell tchotchke. I have to write it down on a little piece of paper so I can remember that. However, I can't tell you how excited some of these companies are, because the poor young person back home who's monitoring the Twitter handle, and they know that a really big conference and nobody's sending them any info, because the sales reps are notoriously terrible about doing social media themselves. But if you tweet from the booth, you're going to get some social media love just like that. But, thanking the people who have put the event on, who support the event, will always go a long way. And then, there's going to be some fun at the event, but it doesn't mean that everything has to be in social media. So I would just say, if you guys are having a great time and there happens to be a hula contest or somebody's doing the limbo, they may not be showing at their best. So even though you've all been tweeting all day, that doesn't necessarily mean that that's the time to tweet. So before you, take a picture, or when you take a picture, you'd say, hey, can I tweet this? So that some people are like, I'm happy to be in a picture, but I don't necessarily want it to be in front of every person that I know. So in the after hours, double check that it's cool. All right, and then of course, have fun. And here are a couple of great examples of folks that, met up at a conference and, did some fun things together and wanted to share those moments. So I highly encourage you to find opportunities to tweet each other out and to show the fun and social side, because again, that helps encourage people to come next year. All right, and guess what? We should be following.
Yes, KFP. And I put, actually a couple places here on Twitter, on your left, on your right. Make sure you go out and like the KFP Facebook page. Go ahead and love it. Give them a nice the new little icon is a thoughtful. I'm being thoughtful. You can get a little flower and share. Invite all your friends to like them too, because you want to leverage again the awesome work that family physicians are doing across the state, across the region. There's some great innovative work being done. And also, again, just a shout out, our social media ambassador, official social media ambassador for this year's KFP annual meeting is at Jen Mac. So she's got some great tweets out there, and she's a great person to follow. I think she does a great job.
All right, I dare you all to say that 3 times fast. And hopefully she's tweeting out. Now, I know we ran long because there's always so much more to say, but we do have some opportunity for questions if you are curating Carol and want to share those. And while we wait for those to pop in, I just did want to share with you how happy Carol and I were to be here today, and that we are day 1 of our official launch of the healthcaremarketingnetwork.com. And what it is a community of healthcare writers and marketers who've come together to support family practices. So I would love to have you follow up with us and tweet to us or email us, either way, and let us know if you have any needs in regards to having content created for your practice. We are here to help you. So how does it look for questions?
Okay, so I just want to say a couple things from Carolyn are that she spoke with Dr. Mike Sevilla and Dr. Ryan New, and both have promised to retweet some of the conference tweets. So that's some great amplification there.
Great.
Also, she mentioned that they do use Storify day 1, day 2, day 3 of the annual meeting. So that's a great benefit. And let's see. Okay. One question is, as a conference sponsor, is there a statement we should communicate to attendees about having their picture taken and used in various publications?
So the rule of thumb actually is that you're at a public event. So in theory, if you take a picture at a conference, it's in a public space. So therefore, there isn't a legal requirement to get a permission per se. Now, that being said, and you've already done some printing, but I would actually put something on the website and or in the program that says, there will be videography and photography throughout the event. So be aware. And it basically just identifies that it's happening, and people will just know that if they had an issue with it, then they probably wouldn't come. So hopefully that isn't going to be the issue. But the other thing is, if you have table tents for the meeting areas that reference the Wi-Fi code, that also might be another place where you could put in writing that active use of social media is encouraged. So, please be aware. And then just leave it at that. It's individual's choice and judgment about whether that impacts them or not.
Yeah, awesome. I know that a lot of conferences and events of all sizes anymore are in the registration language, including that information as well. So in a little bit of every place, I think. And just double checking to see if anyone has, I don't see other questions right now, but I do just reinforce what Janet said. You can see our email addresses. We're definitely, open to, if you have questions, etc. I will be attending the conference, so I'm really looking forward to that. And I'm looking forward to live tweeting and meeting up with folks. I think it'll be a blast.
Awesome. Well, I thank you very much, Carolyn, and everybody else at KFP for inviting us to be here today. This was a really exciting opportunity, and I'm an evangelist, so I hope to see you all tweeting, and I hope that you will reach out via Twitter. I'd be happy to follow you back.
Awesome. Wonderful. You guys have a great afternoon, and thanks again.